Well, good afternoon. Thank you so much for tuning in to Science TV. Welcome to 4 p.m. news. My name is Chris Mololo. Our sign language interpreter is Gideon Minor, and these are the latest in the world of news this hour. The Employment and Labor Relations Court in Eldoret has suspended the national elections of the Kenya Union of Nurses and Midwives, KNUN, which were scheduled for tomorrow, the 6th of February 2026. The suspension comes pending the hearing of a petition challenging the legality of the electoral process. The petition, filed by union member Kibi Koech Simeon, argued that the elections were unconstitutional and unlawful, claiming that the union's constitution had been imposed without a proper referendum, violating internal procedures in the Constitution of Kenya 2010. In its ruling, the court directed that any fresh election notice must comply fully with the KNUN Constitution, be widely circulated to members, and ensure that candidate eligibility aligns with both the union's constitution and the Labor Relations Act of 2007. Moving on, the Katiba Institute has written to the Office of the Controller of Budget requesting confirmation that no funds have been approved or released for the 21 former advisors of President William Ruto. This follows a High Court ruling that declared the advisory offices unconstitutional. The letter, addressed to Controller of Budget Dr. Margaret Nyakango, seeks written assurance that salaries and allowances for the advisors have neither been authorized nor paid, and that no future payments will be made. Katiba Institute has asked for a response within 14 days to ensure compliance with the court's judgment. The High Court had earlier ruled that the creation and staffing of the presidential advisory offices lacked legal basis, making the positions null and void. The civil society group cited Article 228 of the Constitution, which requires public funds be spent lawfully, in its request for strict adherence to the ruling. In other news, lawyer and politician Nelson Harvey has urged members of the public not to send him unsolicited advice regarding his decision to join the Democracy for the Citizens Party, DCP. He made the appeal on social media, asking people to avoid spamming his messages with opinions on his political choices. Harvey questioned why critics were offering advice only now, 4 months after he resigned from the United Democratic Alliance, UDA. He challenged those who disagreed with his decision to test their own mandate if they believed they knew better. The remarks followed Harvey's official joining of the DCP, a move that has attracted public attention and debate ahead of the 2027 general elections. He emphasized his resolve to make independent decisions while continuing his political journey. Medical Services Principal Secretary Ouma Oluga has reaffirmed the government's commitment to providing personalized care for cancer patients across the country. He emphasized that each patient's social, financial, biological, and clinical circumstances will be considered in delivering treatment, ensuring that care is tailored to individual needs. Speaking during a recent health forum, PS Oluga highlighted ongoing efforts to strengthen the healthcare system. He noted that improving infrastructure, training medical personnel, and expanding access to essential medicines are key priorities in enhancing cancer care services. PS Oluga also acknowledged existing gaps in the system and assured that the government is working diligently to address them. By focusing on both patient-centered care and systemic improvements, authorities aim to reduce disparities in treatment and improve outcomes for cancer patients nationwide. Elsewhere, residents of Shur in North Hor constituency, that's in Marsabit County, have raised concerns over the lack of maternal health services at Shur Hospital. The hospital reportedly has a dedicated ward for maternal care, but residents say services are not adequately provided. The community cited a shortage of specialized equipment as a major factor contributing to the problem. Expectant mothers are reportedly forced to travel over 40 kilometers to access essential maternal health services. Residents have called on relevant authorities to ensure Shur Hospital is equipped with necessary resources and facilities to improve maternal health care and reduce the burden on expectant mothers. To some other news, residents of Embobut, that's in Elgeyo Marakwet County, have signed an agreement to end female genital mutilation (FGM) in the area. The ceremony was held in Iten town, bringing together community members committed to abandoning the practice. During the event, residents highlighted that although many in the community had undergone FGM, they have seen no benefits from the practice. The agreement marks a significant step towards protecting the rights and well-being of girls and women in Embobut. Community leaders and stakeholders called on all families to honor the pact and work collectively to eliminate FGM, emphasizing the importance of education and awareness in sustaining the initiative. And lastly, the Seventh-day Adventist SDA Church in Nakuru has terminated 19 pastors following allegations of misconduct and the formation of an unauthorized organization. Excuse. The move comes amid claims that the pastors acted in violation of church doctrine and governance. The Nakuru-based SDA Central Rift Valley Conference, CRVC, stated that the affected pastors allegedly aligned themselves with a parallel entity contravening the official charge manual. This action, according to CRVC, undermined the church structure and authority. Church leaders emphasized their commitment to maintaining discipline and doctrinal integrity within the SDA community. They warned that any future attempts to create unauthorized organizations or defied church rules would face strict consequences. Well, those are the updates that we had for you for the 4 p.m. news. For these and more stories, visit our website www.sciencetv.co.ke and also follow us on all our social media platforms. Also, remember to join us at 7 p.m. for the Science TV Prime News. But for now, we say goodbye. My name is Chris Mololo. Our sign language interpreter has been Gideon Minor. Keep it Science TV and enjoy the rest of your viewing.